يتفضل الآن الطالب نايف ابن محمد لتقديم البحث الثالث.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. My name is Naif Mohammad. I'm third year's medical student. I'm here today for presenting an overview of the pandemics of the COVID-19 and its associations with the comorbidity. First, the introductions. The pandemics of the COVID-19 has become the biggest of the health concern nowadays, due to the spontaneous enhancement in the cases. The COVID-19 outbreak was, and until these days, one of the public health emergency. The various studies have been reported that the fatality of the COVID-19 is enhanced with the older age, as well as the people with the pre-existing medical issues. The presenting study is designed to recording the impacting of the COVID-19 on the populations with the comorbidities to avoiding the delay of the diagnosis. In the objectives, the studies is focused on to study the populations and the death with comorbidities infected with and uninfected with the COVID-19, and to study the complications in the persons suffering from the COVID-19 with and without the comorbidities. The method used in this overviews. First, we starting with the interviews with the patients. The second one with the study will be performed through the online survey using the Google Forms or interviews through the platform. And the recent studies will be carried out on the populations infected with the COVID-19 with or without the comorbidity and admitted to the hospital in the Riyadh regions. The criteria of the method used in the research. The inclusions of the criteria, the populations with comorbidity infected with the COVID-19 and the populations with the comorbidities not infected with COVID-19. The populations infected over age 18, male and female in the Riyadh regions, and the excluded criteria is children and the populations outside the Riyadh regions. As we can see in this result, the highest frequency rate seen in the patients with the malignancy and the diabetes, and the highest fatality rate seen in the obesity as well can we see. In the discussions, the resulting of revealing that the persons with the pre-existing comorbidities like cardiovascular disease and the hypertension and the diabetes and the cancer are more vulnerable to infected with the COVID-19. In the conclusions, on the basis of the findings, it can be hypothesis that is the persons with the pre-existing comorbidities like cardiovascular disease and the hypertension and the cancers are more vulnerable to get COVID-19 infected and can be leading to the worst outcomes. Some other important suggestions were also will also, such as in the cases of the diabetes, frequent monitoring of the blood glucose is suggested, and the applications of the ASI and the ARAP should be continued in the cases of the hypertension and the cardiovascular disease, while in the anti-tumor treatment should be avoided or stopped if possible during the pandemics of the COVID-19, as it suppresses the immune systems. Reference? Thank you.
So any of the student has a question? Okay, so we will accept Dr. Ahmed just to ask one question.
Thank you, Naif. But the result, Naif, is not clear. It is only one slide. You pass it quickly. We are not known what is the clear result you show. The diagram is also not clear. So please recheck, re-show the result.
Okay.
One slide only. What you found. لقيت ايه يا نايف؟ اشرح لنا كده لقيت ايه؟
Okay. The research shows the comorbidities and frequency and of the infected with the COVID-19 and the fatality rate, which can be increasing in some disease, like cancer, as we can see. Cancer of the hypertensive disease.
So Thank you, Naif. And Dr. Ahmed, he usually means like in such research, we have to present it as a result of the research. So the frequency, it is good, but we need to know what is it significant or not. Of course, that you all know about the p-value, like what mentioned Dr. Ashraf and Dr. Shabir about the ANOVA test, about the t-test. So this will give us the significance of this result. So anything that it has a result, but is this result significant? Should I apply it to my patient or not? So this is the point.
Yes, it have significance to avoiding the delay, to delay diagnosis in some patients with the comorbid diseases.
Yeah, this is what you need. I know that you did a great job, but you need to present it here, and actually in the slides. This is for just a comment in the future. Okay. Thank you, Dr. Ahmed. Thank you.
Relax, relax. Your presentation is very good. At the same time, I want to hear what is your conclusion or recommendation after your conclusion.
Okay,
what you recommend
for the patients with the COVID-19 and the comorbidity, avoiding the anti-tumor drugs, using the ASI and the ARAB for the patients with the heart vascular disease, and blood pressure monitoring for the diabetes patients. Thank you.
Thank you.
Thank you.
Sorry to interrupt, sir. One comment about this. The whole world is waiting for the recommendation. So people who are having comorbidities and who are having COVID-19, till it's $1 million question what to recommend in future. So it's too early to ask these early buds about the early recommendation. But according to me, all the students, first three, they shine like a sun when they are presenting. So hats off to them. And the only thing is that we should conduct more and more encouraging programs like this, according to me, because this is my first program here, and I am delighted to be a part of it. And all the three students, they strived a lot to get the data. So my congratulations to them, and they should do more and more like this. And we as faculty members should encourage like this, and they will have a more impact and more valued presentation in future. Thank you, sir.
Thank you. Thank you very much. And yes, of course, that we have to encourage them and we have to help them, and at the same time we have to give our comments, which is to improve their outcome, inshallah.
Thank you.
So thank you very much for this session.